Hello and welcome to my channel again. My channel name is Direct from Doctor and my name is Dr. Shanai. So today I'll be talking a bit about blood pressure, what you should be essentially be knowing about blood pressure. So many people are very curious, they have a lot of misconceptions about blood pressure and hypertension and these kind of terms. So I'll tell you exactly what is blood pressure and what you should know about it very briefly. I'll not go into deep into that science. It's not required. What you should be knowing. See, blood pressure is blood pressure, means pressure of the blood. Okay. So you know the heart. Heart lies here. The job of the heart is to pump the blood. Pump the blood. When it pumps the blood, it goes into the all the tissues through the arteries. It goes into all the tissues up to the last tissue, and all the cells are rejuvenated with the oxygen supplied by the blood, and then it comes back. It comes back through the veins. It goes through the arteries and comes back through the veins, and it re-enters the heart, and it is sent again by the heart to the lungs, gets purified because of our breathing. It gets oxygenated again, it becomes pure again, it is pumped by the. So this is one cycle. Okay, so that one pumping of the heart is called as one beat, one heartbeat. Suppose you feel, everybody knows about the pulse these days. It's felt here. Okay, you can see the pulsation. Your fingers coming up and down, up and down. So those are called the pulsations. That's why it is called the pulse. So usually felt in the wrist. It can be felt in so many other areas also, even here with a stethoscope. So there are so many areas you can, even in the leg, you can feel it, and that pulsation usually it indicates a heartbeat. It's equivalent to heartbeat. Suppose your heartbeat is 60, so it can go up to 100 in some people, nothing to worry, 60 to 100. Pulse also it will be the same. If my heartbeat is 70, then it's 70 here also in the pulse. Okay, so that is as far as the heartbeat goes. But the thing is, blood pressure is slightly different from heartbeat. The heart pumps blood, so at that time the arteries have to bulge, right, because of the pressure, because of the force of the blood flowing in the pump is really squeezes and it pushes the blood. So the arteries have to swell up a little, right? So that swelling action, that is lateral pressure, we call it as, on the lateral walls of the arterial tubes. They are very soft tubes, right? It can bulge very easily. That bulging action is called as blood pressure. It's pressure of the blood on the lateral wall, laterally. It goes on bulging, all right? Suppose you want to know if you can feel the blood pressure over the pulse. Yes, you can have a rough idea also. The pulsation will be too big pulsations. Okay, means really you can feel it, and weak pulsations indicate usually lesser blood pressure. But that is not a measure. But you can say whether blood pressure is more or less. You can say. So to actually measure, what the doctor or the nurse does is they have a meter, big box like thing, and they open it up. There is a big meter there. So that is called as a sphygmomanometer, which contains a mercury. The mercury level rises and goes down. This much millimeters of mercury. That's the way it is expressed. So it has got a cuff which is tied around here. Here there is a main artery which is running called as a brachial artery. It's an important artery, and it accurately gives you the pressure of the blood. They tie it here and go on pumping the air. So it becomes tighter and tighter. So at particular point, the pulse stops, the pressure stops, the blood is stopped there. Okay, so then they will introduce the stethoscope here. They listen and slowly release the air. So again it starts bulging, the air is released, and suddenly the doctor will listen to a sound. So that sound means the blood has started flowing again. So that is the pressure of the blood when the blood comes from the heart. So that is called as the systolic pressure. Systolic pressure. That pressure has to be around 120. In the meter, what they are seeing, in front of them, it should read as 120. Then they will release more and more. For some time there will be only some murmur and so. Then they will listen to another sound. That is called as a diastole. Diastole means between two heartbeats there is a resting period. Pumping, stop, pumping, stop. That stop at that stopping level, there is a particular pressure which is lesser than the systolic pressure. That pressure is called as diastolic pressure. That has to be around 80. If the blood pressure, your blood pressure is read as two figures, upper figure is systolic, lower figure is called as a diastolic. So 120 over 80. So that should be the normal blood pressure. Usually up to the age of 40, it remains as 120 over 80 if the person is healthy. Then after 40, it changes a bit. And even in the normal person, even in a very young person also, in the morning till night, and it goes on varying. It is not the same. For example, when a person gets up in the morning, the blood pressure is more. Then as the day goes by, because of the activities and all that, pressure comes down a bit. So pressure comes. That's why you should be engaging in the activities. So in the noon area time, usually it is normal, 120 by 80. In the noon time, that's why noon is a better time, for measuring the blood pressure. And the evening it comes down a bit more. In the night is lowest. Early in the morning again it's more. It goes on varying. So noon is a better time to take the blood pressure. So 120 by 80, I said, suppose it is more, what happens? We call it as a hypertension. Suppose the blood pressure is more. Suppose the reading comes as 130 by 85. 130 is the upper figure, that is the pumping pressure. And then the lower pressure has gone up to 85, that is the resting pressure. That is not a normal pressure. There is a hypertension, we call it as mild hypertension. Nothing to worry much about it. Not even the medicines are not required for such a minor variation, and in some people it's normal. Then suppose it goes up to say 140, 145, 150, 160, the upper figure. It can go up to 200 also. It can cross 200 also. And the lower figure can go up to 100 also. If it crosses 100, it's very dangerous. Lower figure. That is the rest. At the resting period, if it crosses 100, the lower figure, then it's too much. That needs a lot of treatment. Otherwise, the person may land up with the cardiovascular problems. That means the pressure on the artery walls is too much. That can lead to artery damage. And also it can lead to stroke, it can lead to breakdown of a certain matter within the arterial walls, and that breakdown matter is called as thrombus. So that can go and impact in the brain, and it can lead to stroke, or it can lead to heart attack. So many things can happen. So those things have to be regulated by the medicines, by the doctor will look after it. If the blood pressure is slightly less, for example 115 by 75, nothing to worry. They say it's good, it's good because you are able to do more activities, no problem. But it should not be too less also, because there has to be some kind of a pressure. It should not be too less also. If too less blood pressure is considered to be bad. So this is actually what you should be knowing about the blood pressure. More than this is not required. We can go really deep into this science, but it is not required. So have your blood pressure tested at least once in 5 or 6 months. Go to the doctor, go to a lab, anywhere, even a nurse can do it. So many people do it these days. It's very easy. You can also do it, and you can purchase a blood glucose meter. You can do it yourself. It's an electronic meter. It usually gives more or less the accurate figure. So you can do it yourself and know your blood pressure, know whether you are healthy or not, as far as the blood pressure goes. I hope I'm clear about this, and in case you want to know a little more about it, in the comment section you can ask me the questions. I'll be very glad to answer that. So right now this much is enough to know about the blood pressure. If it's even up to 130 by 85, don't bother. If it goes more than that, please go to the doctor and get it corrected. That's more than enough. So I'll see you in the next video. See you. Bye. Stay healthy.